everyone. Today I am going to introduce you to a new concept which works on advancing the clinical practices. Our idea is deleterious effects of ILV purees intake during pregnancy among tribal community people in Nilgiri Biosphere and the idea for prevention. This is a collaborative project which involves our team members, myself, Amina Mohyuddin, and Fatimat Safa, Dilsha Mehrin, Shahdiyat, Zahra Batul. So let's get started. The indigenous leafy vegetables or green leafy vegetables such as Malabar spinach, Amaranthus, Palak and Cabbage were commonly consumed by all the tribal community people in Nilgiri Biosphere once in a week. Other greens like Manadakalli, Ponnaganni, rhubarb leaves and agati were taken once or twice in a month depending on the availability in the form of a puree. Puree is actually a small smooth paste of liquid or crushed vegetables with salt. The leafy vegetables were steamed or boiled until they reach soft and smooth cream consistency and then blend into a smooth paste. Leafy vegetables contain iron, vitamin K and especially folates, which is good for pregnant women. 100 gram of fresh leaves provide 140 milligram or 35% of folates. The folate deficiency during the early stages of pregnancy might result in neural tube defects, which is NTDs, in the newborn babies. The NTDs develop very early during pregnancy, often before a woman knows she is pregnant. It is due to folate deficiency. NTDs are birth defects that affect the brain and spinal cord. They occur when the neural tube, which is the structure that develops into brain and spinal cord, does not close completely during pregnancy. While some NTDs are visible on ultrasound during pregnancy, others may not be apparent until after birth. The very purpose of preparing food in the form of puree is to reduce the oxalate content present in it, which can be achieved by steaming or boiling, and for ensuring adequate folate consumption. Oxalate content is more in lettuce, cabbage and spinach, but the problem is improper storage of puree or preparation may lead to bacterial contamination resulting in methemoglobinemia, or as we call it, blue baby syndrome. So the spinaches are rich in oxalate. Pureeing will reduce the oxalate content. So in our study, we are basically determining the oxalate content in ILVs and its purees, and we observed a difference in content in all the vegetables before and after preparing the purees. Our future aim is to determine the nitrate content which converts into nitrite in the baby's body and responsible for the blue baby syndrome, which happens with the purees or improperly stored or prepared purees. Pureeing is improper method of preparing food, where chance for bacterial contamination rate is very high, leading to syndrome. So if ILV is prepared improperly and consumed in high quantities, it leads to methemoglobinemia or blue baby syndrome. That is when nitrates can be converted to nitrites in the body, and high levels of nitrates can interfere with the blood ability to carry oxygen, leading to blue skin, as we call it cyanosis in medical term. Methemoglobin content ranging from 0.3 to 3.7% of total hemoglobin is very critical. It is a condition where baby skin appears bluish due to low oxygen levels in blood. So this can be caused by various other factors including congenital heart defects, lung problems and also nitrate poisoning from contaminated water or other certain foods. The blue tint is most noticeable in areas with thin skin like lips, in nails and also earlobes. Other symptoms include rapid breathing or heartbeat, irritability, lethargy, and poor feeding. So this syndrome is different from blueberry muffin syndrome, where symptoms include skin nodules and marks. Also, improper storage of cooked leafy vegetables at room temperature for extended time can accelerate the contamination or conversion. So the conversion rate is more in puree. Boiling and smashing of leafy vegetables results in puree, which is a paste, which is improper cooking where nitrate conversion takes place easily. Physical examination, blood test, and sometimes imaging of heart are some of the methods of diagnosis and treatment. The treatment focuses on addressing the underlying cause, such as surgery for heart defects or medications for blood disorders. Here we are proposing is leafy vegetables should not be given to pregnant women or infant babies before 6 months. Store cooked vegetables in the refrigerator and use them within a day. Avoid prolonged storage at room temperature. Serve immediately and refrigerate and reheat thoroughly before serving for second time. Proper cooking and handling of leafy greens will help minimize this risk. Blanching high oxalate vegetables in boiling water for a short time, that is approximately 1 to 3 minutes, and discarding the water can help reduce oxalate levels. Oxalate content is more in leaves growing in high fertile soil, so care should be taken during collection. 100 gram of fresh leaves provide 140 mg or 35% of folates. Cases are not reported in Nilgiri Biosphere, but many infant deaths happen may be due to the same reasons. So we are currently studying anthropological study, that is in humans, and also empirical study is in progress. Thank you for listening to us.